Boosters is not an absolute fact yet. The need for boosters will depend on several things. It will depend upon the duration of immunity. How long does immunity last after vaccination, which so far is looking good. We've got good data showing that immunity will last for 7 to 8 months so far, and probably longer than that. And it will also depend upon whether the new variants that emerge or may emerge are resistant to vaccines. But right now, all three vaccines are effective against currently circulating variants. And the best way to avoid further variants emerging is to get vaccinated now.
So how many 12 to 15-year-old South Carolina residents have received at least one dose of Pfizer BioNTech's vaccine as of today?
Sure, 22,250 South Carolina residents in that age group have received at least one dose of vaccine. And in total, 22,758 people in that age group have received at least one dose in South Carolina. We've had a few non-South Carolinians vaccinated in our state.
Given the recent drop in COVID testing, is it possible that we might overlook a surge of unvaccinated people contracting the coronavirus this summer, or is that scenario unlikely?
Well, we may get a surge in cases depending upon people's behavior this summer, especially if many unvaccinated people gather together over holiday weekends or attend indoor crowded events. I don't think we'll overlook a surge, though the number of positive tests would probably not reflect all of the people infected, which has always been true. What we will be doing is monitoring not just the number of new cases, but also the percent positive to make sure we're doing enough testing.
Dr. Kelly, in your update, you mentioned summer. We're right there. So how does DHEC feel about large outdoor gatherings like the Carolina Country Music Festival in Myrtle Beach that will bring in thousands of people now that there are no capacity restrictions?
I can't stress it more strongly. The safest way to attend big outdoor gatherings is with vaccine on board.
What type of precautions would someone need other than being vaccinated to stay safe at these events?
Sure. Masks do still work. So masks, keeping your physical distance from non-household members. Remember that outdoors is better than indoors, but even outdoors can bring some risk if it's a crowded setting. And washing your hands is still important to prevent spread of the virus.
Two questions here about the Janssen vaccine or Johnson & Johnson. Do you anticipate ever getting enough supply of J&J to provide it to any partners outside of the mall site? And if so, could it be used in the more rural areas since storage is less of an issue?
Absolutely. And in fact, this is currently going on. There are several providers, including independent and large chain pharmacies, that are utilizing the J&J vaccine. DHEC will continue to coordinate with CDC on its federal allotment.
How many COVID-19 vaccine doses has South Carolina received?
4,680,450 doses. And that's excluding the federal allotments that went to Bureau of Prisons, Indian Health Service, the VA, and the Department of Defense.
And Dr. Kelly, do you know how many have expired at this point?
We don't have that specific information at this time. VAMS only has the functionality to track vaccine expiration since May 15th. So what I can say is that current value is 4,738 doses.
And does DHEC or providers give priority to vaccines nearing an expiration date?
Yes, it's the goal for all providers to be good stewards of the COVID-19 vaccines, specifically paying close attention to the expiration date and try to utilize the short-dated vaccines first.
Here's some questions about the vaccines. So what's the shelf life for the 3 vaccines South Carolina is currently using? So for Pfizer, Moderna, and Janssen.
So it varies. So for Pfizer, and until you can use it until the expiration date, and that depends on the lot number. But in general, it can be about 3 to 5 months out from the receipt of the vaccine. Frozen, it'll keep for 2 weeks. Refrigerated, thawed, 30 days. From Moderna, it's kept frozen until the expiration date. And again, it depends upon the lot number, but generally speaking, 3 to 5 months out from the receipt of the vaccine. Refrigerated, thawed, it can be kept for 30 days, and at room temperature can be kept for 24 hours. Janssen vaccine, refrigerated until the expiration date, depends upon the lot number, about 2 to 3 months out from the receipt of the vaccine.
Dr. Kelly, based on the mutations present in the Vietnam variant, would people in the U.S. have to be more concerned than they are for any other more contagious variant that's already here in the States? Would the vaccine be expected to be effective against this variant?
First, let me say a little bit about the variant that some people have been referring to as the Vietnam variant. Remember that that variant was recently identified in Vietnam, but it could have originated elsewhere. And in fact, it's quite similar to the variant that's circulating in India right now. It hasn't been fully studied, fully characterized yet, but it has some mutations that we've seen before, that we've seen in other variants that make it more transmissible, meaning that it can spread more easily. There's no evidence that it is more lethal or that it causes more severe disease. And as far as we know, the increased transmission is the main problem. And vaccines, the free vaccines that we have available in this country, are all effective against it. Now, what might happen in the future? Would there be more variants, more contagious variants that would emerge? That's a possibility. And that's why we urge everyone to get vaccinated as soon as they can to help block the emergence of other variants.
Dr. Kelly, this is a reporter that says they just got a viewer question asking if the COVID vaccines contain something called SM-102.
Sure. And the Moderna vaccine does contain SM-102, which is a lipid, a fat, an oil. And it's, the purpose of that fat or oil in the vaccine is to protect the messenger RNA from getting broken down before it has a chance to get in the immune system, get into the body safely, and start making the spike proteins. SM-102 is safe for humans in vaccines.
And Dr. Kelly, that was the last submitted question. I apologize to our media folks. I usually let you know when we're getting near the end. So the questions that you may have can be top of mind. But at this point, we are going to open it up for live Q&A. So I would ask, if you have a question for Dr. Kelly, please raise your virtual hand and I will call on you. And I do ask that you only ask one question, then we'll cycle back through. We have plenty of time today. So it looks like I see a hand up from Dana. You've got a question?
Yes, and it just popped into my head. Hi, Dr. Kelly.
Hey.
Just if you have any idea, the expanded homebound vaccination project, do you have any idea how many homebound people this could potentially reach?
I don't know the exact number, Christy. I don't know if you do, but I know that this has been an important effort. We know that there are a large number of people who are absolutely homebound or who have a lot of difficulty getting out to get vaccinated. But I think we might have to get back to you with the exact number.
Yeah, that's exactly correct. Dana, I was just typing as Dr. Kelly was talking. Yeah, we'll get back to you on that figure. Vanessa, you've got a question?
I do, and thank you for the opportunity and hope you all are doing well. I wanted to follow up. I was actually the reporter who asked the question about SM-102, and the viewer who emailed us seemed to be under the poison, and I know you said that it was safe. Do you have any idea where that misinformation might have come from? Like, is there a misunderstanding maybe perhaps?
I have to wonder, some of these ingredients are used in multiple other products. They're used in industrial products. They're used in other chemical processes that need protection by a coating of oil. So I have to wonder whether he or she looked up that ingredient and found it linked to some other ingredients. But I literally went to the Moderna FDA approval document to look up the exact chemical ingredients in the vaccine. And SM-102 2, and there were 3 other oils, 4 salts, and a sugar, and that's it. Nothing that would be dangerous.
Dana, you've
Thank
got a
you.
question. Oh, I'm sorry, Vanessa, didn't mean to talk on top of you. Dana, you've got another question?
Oh no, I just said thank you.
Again, something just popped into my head. I got I'm getting in today's mail, my card, the outreach card that you guys sent out. How many other outreach programs do you have going now, or are you planning?
Christy, I'm going to have to bounce that one to you also.
And Dana, I probably will need to get back with you. So that was a mass vaccination, direct mail. That's the first time we've done that to every South Carolina residential address. I think I got my postcard last week as well, and proudly on my refrigerator. In addition to the homebound vaccination program, I believe it was Dr. Troxler maybe last week or the week before that mentioned that, we're looking to do things with, festivals, basically going to where people are. So not in addition to the homebound folks, we're also looking to, just get out into the community and make that available. And we're looking at all kinds of incentives. So we did launch a digital campaign today. One of the things that we really need folks to do, I know Dr. Kelly will agree with me, is if you've gotten Pfizer or Moderna, the 2-dose series, you really need to get that second shot for full protection. And we do have a lot of folks that have started the vaccination process, but they haven't finished it. And so we do have a digital campaign that started today called Don't Half Vax It. And it's meant to be a little cheeky and to get some attention. So be on the lookout for that. Mike, you've got a question? Mike, can you unmute? Mike Ellis, I think you're having trouble unmuting today. Keep trying. We'll see if you can get in. If not, maybe drop your question in the chat and we'll get back to you. Vince, you've got a question? Vince, are you there? I saw you on mute, but didn't hear you. Maybe try again.
And I am watching the chat box, so if you're having trouble, put it in the chat box and I can answer.
I think we're just having some trouble today. It happens. Does anyone else have a question? Vanessa, you've got another question?
I do, and I know that our trends in general seem to be going well as far as the metrics are concerned. Always in the back of my mind, I'm thinking, what can go wrong? I think it's maybe just a little bit of, experience. Are there any factors that y'all are watching that could be potential foils to the progress that we've seen? Maybe any specific upcoming seasons, for example, fall or winter? I know that can be a rough season anyways for respiratory illnesses.
So if we're thinking all the way to the distance, thinking of fall, we also have to think about other respiratory illnesses. And we certainly have concerns about that, about influenza, for example, coming back with a vengeance. We need to make sure people get their flu shots as well. But in the immediate future, I think we are concerned about large gatherings. Outdoor is safer than indoors, but outdoors, if you're really gathered closely together, is a risk for people who are not vaccinated. And last year, we saw a surge after the 4th of July weekend. So we are concerned about that as well. The good news is we do have a number of people vaccinated in South Carolina. I'm not worried about them. I'm worried about the unvaccinated, people who haven't been vaccinated yet.
And Dr. Kelly, Vince dropped a question in the chat. He says, do you have any quantitative data that shows the change in vaccination rates in Jasper and Hampton counties before and after launching the pilot homebound program?
I bet we do, but I don't know them off the top of my head. So I think we would have to get back to you on that.
Yep, that's correct. Vince will follow back up with you. Let me look and see if there are any other questions. Mike, can you try to unmute?
He's got it. He's in the chat box.
Okay, great.
Asking about after hours and on weekends. largely pharmacies here, and two parts of this question. Are we doing enough to get access for people who work off shifts or multiple shifts? What else can we do? And since those people are probably the least likely to be able to raise their hands and say they're having a problem, how do we know if we're reaching them? Well, as Christy mentioned, we're trying to do more outreach to rural communities, more outreach to people who are not necessarily facile with going online to make an appointment by having more walk-in clinics or having clinics, mass vaccination sites, but also working with smaller partners, working with community centers or churches or schools, employers that want to have on-site vaccination clinics to make it more convenient for people because that's where they already are. And in terms of hours, I know some of our pharmacy partners have definitely extended hours to try and make vaccine more available to people who are working and otherwise can't get off during the day. But I know that many employers are also advocating for vaccine by permitting their employees to take some time off to go, paid time off. To go get vaccinated, and even paid time off if they're having some symptoms the day after vaccination.
Jason, you've got a question?
Yeah. Hey, Dr. Kelly. I sent in those questions about the expired doses. What is the procedure for maybe doses that aren't used? I know we're at about 72% utilization rate here in South Carolina. What is the current protocol, or how do we handle doses we aren't using right now?
You mean doses that have expired? What do we do with them?
Yeah, and the ones that are kind of maybe just sitting around, waiting for more people to come in and get them.
We do have some mobility with vaccines. So, for example, if a vaccine provider or an event had a certain number of vaccines and didn't use as many as they thought they anticipated needing, we can sometimes just move those vaccines to another site to fulfill needs in another place. So, it's in the very beginning, remember when Pfizer had those extreme cold chain requirements, and we didn't have Janssen vaccine, for example, and it appeared that the duration of before expiration of vaccines was shorter. We have a lot more flexibility now, so we can move vaccine from one site to another. And sometimes we're not the ones that are doing it. It's in fact our vaccine providers are cooperating amongst themselves so that if one had extra vaccine, they might give it or lend it to another. So there is some fluidity to that, some flexibility about that. Inevitably, we're going to have some vaccines expire. We have a lot more vaccine available now, so that's not the big concern. The big concern is getting vaccine into arms.
Are there any other questions for Dr. Kelly today? I know the update today was quite brief, and we didn't have as many questions come in, which is totally fine. But this is your time with Dr. Kelly, so I'll ask again, any final questions for Dr. Kelly before we close out today's briefing? I don't see any hands raised.
And I would just finish with, again, going back to the original, our opening discussion about hurricane season. Getting vaccinated is part of hurricane preparedness. I can't emphasize that enough. People may feel that they are being safe right now in their behavior and therefore don't need urgently to get vaccinated, but you never know what hurricane may throw into your life, that you may need to evacuate and be thrown into circumstances with other people who are unvaccinated. So we're just urging everyone, put vaccine on your hurricane preparedness list.
You've got it, Dr. Kelly. And also, I think a lot of times folks in South Carolina may think, well, I don't live on the coast, so, I don't have to prepare as much. But that's, certainly not the case. Everyone needs to prepare who lives in South Carolina. You may need to take in a family or friend from the coast that might need to evacuate. So again, just super important to get vaccinated. There are plenty of opportunities. Again, the Community Vaccination Center at Columbia Mall is open from 7 a.m. to 7 p.m. So we do have some extended hours at that location, I know. And it's open through June 9th, offering Pfizer vaccine and also the Janssen or the J&J vaccine. Dana, you've got another question? Can you unmute, Dana? Dana Lynn? Here you go.
Something real quick on hurricane preparedness. 1.3 million people were told to evacuate the coast for Floyd. Guess where they came? Augusta, Georgia. Not all of them, but you can't stress that enough. It was a sudden evacuation order, and people got inland as far as they could and then just stopped. We're used to big crowds here in Augusta, Georgia. We handle them 10 days a year, every single year in spring. You know what I'm talking about. We know how to handle a crowd, but you got to let us know you're coming. We had no hurricane problems. Our hurricane was bodies, and they were everywhere. They were in schools, they were in churches, they were in rec centers, I think they were in the James Brown Arena. So yes, what you said about this being part of your hurricane preparedness, you don't know when you're going to be told, get out of Dodge, and you don't know where you're going, and you don't know who will be there with you. I'm done teaching.
Thank you, Dana Lynn. We appreciate that. And yes, hurricane season, the Atlantic hurricane season does begin on June 1st and it goes through November 30th. So we're talking about the next 6 months. So yeah, that's why it's so important to stress it now. So with that said, I think we'll go ahead and end today. I just want to thank you, Dr. Kelly, for your time, and thank our media partners. We will follow up on a few questions here with reporters. And if you've got any other follow-up questions, please send those to our Joint Information Center and we'll get those answered. Laura and Derek on the team will help to get those answered quickly for you. We appreciate your time. We appreciate you guys. You know, we're about 1.5 years into this pandemic, and you guys join us every week. You're getting out great coverage and great information to keep South Carolinians safe. So thank you so much for everything that you do to help keep our neighbors, loved ones, and friends safe. We will join you again next Wednesday at 2 p.m. Thanks, everyone.
Thanks, everyone.